Okay, part 2 of the H&P, or the history and physical. I was talking about the social history. The tobacco is important to ask about cigarette, vaping, e-cigarettes, snuff, chew, any type of tobacco product that they are using. Okay, when you write cigarettes in particular, you have to ask, write that in pack years. And again, that is to help anybody that's looking at the medical chart kind of understand what the risk may be for this particular patient in respect to diseases that could be influenced by tobacco. Okay, lung, cardiovascular problems, cancer, to name just the top 3 probably. Okay, alcohol, you need to write type, amount, how often, legal and illegal drug use, marijuana, and then a host of other drugs. And remember what I said in class is that, if they're actually using, you could ask how much of, how much do they spend per week on something like this. That might give you an understanding of, what kind of an addiction they may have. When you're talking about immunizations, okay, I just want you to know 2 things here. Number 1, adult and children have different immunization schedules. The CDC is the one who does this. Okay, they basically sometimes change these on a yearly basis. Okay, not too much change once you learn them. Okay, I don't need you to learn these. I just want you to know that it's the CDC that has both adult and child immunization schedules, so that according to the patient's age and also any disease processes that they may have, there are certain recommended diseases that will be ordered by the physician, or you may be working, or provider, I should say, or you may be working in a place that has standing orders, and they give you, they basically say, if it's recommended and the patient and parent or whoever wants it, you can give it. That's what we call a standing order. Okay, so you really do, eventually in the program, you will learn how to read these immunization records, because that's exactly what you're going to be doing. When you give flu shots every year in a hospital setting, right? And that usually is done September, October. But if you're hospitalized and you haven't gotten it, guess what? There's a standing order in most hospitals for you as a nurse to just give it. You give that, you give a pneumonia shot if they qualify. So I think those 2 right there are really important to know. The tetanus, which is tetanus and diphtheria, and the tetanus, diphtheria, and acellular pertussis are 2 that are important immunizations for adults, and really anybody, I think it's 11, if I'm not mistaken, 11 and older, that you start to give, the Tdap every 10 years, okay, or the tetanus and diphtheria every 10 years, with at least 1 booster if you're an adult. If you're pregnant, you're probably going to be getting it with every pregnancy, okay. And just again, just know that the most important part here, okay, is that, again, CDC recommends childhood and adult immunizations. And then this part about that I don't want you to be putting up to date per patient. You can put up to date per patient, but you cannot, if the patient says, yeah, I think I got my tetanus like September 3rd of last year, right? Unless you are looking at another medical record that shows that there was someone actually gave that shot on that date, please don't list it. You can just say per patient, okay, believes that they're current, okay, or like what I put here, pending record, okay, because it's actually falsification of the document, for you to actually take their word for it. That you can't do that, okay. This helps to ensure, I'm sure you've heard the term herd immunity. It really does ensure that people are not falsifying these things, okay? You can lose your license very easily, okay, if you falsify records. You don't want to get caught doing that, okay? So yes, that's super important, okay? Allergies. You want to mention what medications, what environmental allergies, what food and latex. But in addition to, what reaction do they have? You know, is it severe enough for, like, you know, anaphylaxis type of reaction where you swell and you can't breathe anymore? Or is it just like, I get some nausea, maybe vomit, you know? You need to, again, list that. Current medications. You should be asking about vitamins, herbal supplements, over-the-counters. And the way you should really do these, and when you are noting this, is you want to list, just like this says, the name, dosage route, how it's prescribed, how the patient is actually taking it. That may be two different ways. The physician or primary care provider says one thing on their prescription, but the patient's like, I can't take it, I can't afford it, so I've been doing this instead. Or they misunderstood. Sometimes people, especially who speak another language, it's real common for that to happen, okay? And then when was the last dose? That's important because sometimes you don't want to, like, you know, double up on something if they've already taken it, okay? Family history. For each, you want to write down the age of diagnosis, if the person's alive or deceased, and what condition could have, you know, if the condition led to their death, okay? If the patient's adopted, sometimes you're just going to kind of put patient adopted and skip all of this unless they happen to know their biological parent information. And sometimes they do. So don't assume, you need to ask, okay? Health promotion is sometimes written in a chart and sometimes you may not see it in a chart, okay? But things that go here, important for you to know, is when was the last head-to-toe physical? For those that are 65 and over and on Medicare, have they had their annual wellness exam? That is a time when a patient can sit with their provider or their nurse and just talk about how to keep themselves healthy and how to coordinate all the care. Have they had all their screenings? Okay. Which leads us to required screenings. The only thing I want you to know is that these people here, the United States Preventative Services Task Force, there's a website that you can look up what is recommended screening for this patient based on their age, based on their gender, okay? And I believe it also takes into consideration whether or not they smoke and are sexually active. I think they ask all those questions. But I just want you to know, required screenings, this is where you're going to go look as a nurse, okay? For TB or tuberculosis skin test, this is another screening. A lot of people want to put that under immunizations, but it's not an immunization, okay? This is a screening test in the United States, okay? And these are the people who would get it: homeless, anyone who's incarcerated, anyone who's traveled to a place that has tuberculosis kind of running rampant, okay? Other parts of the world, Mexico, India, you know, South America, you know, there's lots of places in the world, China, you know, where this is very common. Anyone perhaps with a chronic cough, immigrants are another group, okay, as well as certain people who work in certain areas, you know, healthcare workers, you guys had to have one. School staff, sometimes daycare centers will require them, okay? So, you know, you kind of just want to ask. If they tell you, oh, no, they told me I could never have that again because I really reacted, then they should at least know when they had an x-ray and they had someone actually, like a medical provider, physician, practitioner, PA, actually do an examination, okay? Or they sometimes get blood results to check for what we call active tuberculosis, okay? What do you need to know from that? Just that tuberculosis is a screening and it goes under health promotion, okay? Review of systems. Please understand that this review of systems, did it stop? Oh no, it didn't. Okay, I apologize. All of a sudden I couldn't see my screen. So the review of system is a section that reviews screenings for symptoms in other body systems which can or cannot be relevant to the reason why the patient is being seen. This section, or being admitted, this section should be done systematically from head to toe. All body systems are covered to identify symptoms that the patient may have forgotten or doesn't even realize that relate to the presenting symptom. And then, just keep in mind that all of the review of system is subjective information and should be written as such. This is why it's important that you understand that the report, like they'll usually be written as denies or no. Okay, no meaning that the patient says no to changes in skin color, pigmentation, or nevi. Okay, and again, this is going to look very similar to that within limits, right? Within normal limits. Nursing review of systems and that you will, these are the same, pretty much the same thing. Okay, remember what I said about that if you haven't watched that screencast already. And then finally, the physical examination. Okay, note that this is where objective information is written. Again, objective information is what you see, what you take, what you measure, okay? What tests you actually perform and have done and you have results for, okay? This is what, again, is written. This part here will differ slightly from the within normal limits for your nursing, because this is written as you may see it from a perspective of a provider. Again, I am showing you what an H&P may look like if written by a provider, which if you start to compare both documents, is going to be a little bit different. Maybe not so much, but a little bit, okay? The nursing is a little bit more truncated, more simpler to the point, okay? Do know there's a few things here that I need you to know. Number one, objective information starts here with height, weight, BMI, blood pressure. You need to tell me what arm it was written, how they were sitting, laying, map, calculate that mean arterial pressure, temperature, how was it taken, pulse, respirations, what was the pulse ox? Was it in room air or was it with any other type of, oxygen source? And you would have to put nasal cannula or a mask that was delivering a certain amount of oxygen, okay? I also want to let you know that when you're writing percentiles, height and weight, and even BMI, and even what we call weight for length, I believe up to age 12 months, I think, 12, 18 months. I can't remember what the cutoff is there. These are things that on a pediatric patient, especially under the age of 21, you will have to chart, or sometimes the electronic medical record will chart a growth chart. And in that growth chart, you will see certain lines that tell you what the percentile is for that particular height, the percentile is for that particular weight, what the weight for length percentile is, and what the percentile is for the BMI. And that just kind of tells you that, you know, a growth chart just basically tells you that they took about 100 kids of that age and they lined them all up. Okay, there's some really thin ones, right? I call them the little shrimps, thin, short. And then there's some really tall ones, maybe, right? And there's some, and everybody else in between. And some are a little heavier and some are a little, you know, lighter. But there's a wide variety of normal. And that's what the percentile is trying to get you, is what's normal, okay? And normal is pretty much anywhere between the 5th percentile rank and the 85th percentile rank, no matter what you're looking at, okay? Above that, it could just be that their parents are really tall, right? Or it could be that, you know, maybe their weight is a little bit, they haven't took off yet, you know, with like growth spurts. Okay. Or for weight, BMI, it could be that maybe they're eating the wrong things. They're eating junk. And we need to have a discussion with a parent about that. Okay. Again, something so important that nurses, you guys are going to be doing, okay, is educating your patients. So I tried to go through this to really tell you what you should know, okay, for the test, try to alleviate your fears. But those of you that are not reading, and I kept seeing this time, week after week after week, I don't know how you expect, and I'm just being brutally honest with you. How can you expect to be a prudent nurse, to be a safe nurse, if you don't read at all? So at least go back and try to read the things that I have talked about in class, that I have focused on here, because I think that will really help you. Good luck. I want you to be an awesome nurse, okay? Your patients depend on you. Remember what I said? You're the eyes, the ears, you know, of the physicians, the practitioners that are responsible for the care. We're not there 24/7, right? Nursing is, and you're going to be an RN and responsible, okay? You can do it. I know you can. I had to do it. I don't have anything different in my head that you guys have, okay? So please do it. Good luck. Hey students, I'm going to pick up here talking about the social history. I know I talked about this in class, but this is important that you pick up, that you ask about vaping, e-cigarettes, snuff, chew, any type of tobacco. People even do hookahs, right? So you do want to ask about that. In particular, if they're smoking cigarettes, you want to list that in pack years. Or if they're using vaping e-cigarettes, how many little pods are they going through in a week? Okay. Alcohol, type, amount, how often? Legal and or illicit drugs such as marijuana, meth, cocaine, heroin are all important. And then if they do have that, you should probably be asking how much of a weekly expenditure are they using. Okay. Immunizations, all I want you to know is the CDC has different charts for adults and children. And you can see that right here, okay? You can click on these active links, kind of go check it out. I don't expect you to know any of that other than the ones that I have listed here that we've discussed in class. Tetanus, diphtheria, or a tetanus, diphtheria, acellular pertussis. These have to be given every 10 years with a Tdap, given at least one booster for all adults. You also need to know that pregnant women have to have the Tdap with every single pregnancy. Okay. Pneumonia. Usually people in certain health conditions will qualify. I mentioned some of those maybe in class. If not, just know that people 65 and over can, will need it. Okay. But also, I think in the respiratory system, people with chronic lung problems do need it. Okay. At a younger age than 65. Influenza. Yearly given September, October, but there's certain healthcare workers that need it. People at schools sometimes will need it. But it can also be given up to April 30th. Okay, and in many hospitals, I just want you to be aware of this, is that you will be working with standing orders. That means that you have to basically know who should get this by looking at the CDC recommendations. That's how come I have given you this information here. Okay, not that I expect you to memorize those charts, but to know where to go look for it. Okay, so for the test, immunizations, adult or child, you're going to go look in different areas. Okay, and also know that certain health conditions may qualify them for certain things. Okay. Childhood immunizations, the most important part here, other than to know where to go, to look at the chart. I'm not going to show you how to do that now. You need to know that you could put up to date per patient, okay? But you cannot physically write. Like if I were to tell you, oh yeah, I had my Tdap back in August 1st. Unless you're looking at another medical document or a shot record with the patient's name, date of birth verified, you cannot physically transfer that date into this medical chart. Okay, if you do, without the actual record of the shot, right, you could be falsifying information, and that is something you could get into a lot of trouble for and potentially even lose your license. So don't do it. Okay. You could write pending record, patient thinks that they're up to date, but we're going to get the record. Okay. Allergies, medications, environment, food, and latex. Please write down what the reaction is. Very different if I have just some nausea, vomiting, mild, right, nausea, maybe no vomiting, to like a severe anaphylactic type of reaction where I can't breathe, I can't even, and I'm swelling up everywhere, okay? And my whole vascular, like my, blood pressure is crashing, okay? Two very different things, but you do need to communicate that to all healthcare workers. So you need to ask. That's super important. Most likely will be on the test, okay? Current medications, including vitamins, herbal supplements, over-the-counter. What you want to do, again, this is the important part. How am I going to list it? You want to list the name, the dosage, the route. Is it oral? Is it topical? How is the patient using it? Is it an injection, subcutaneous, intramuscular that they give? Okay. How was it prescribed? So this would be like on the actual bottle or whatever, that you're looking at. This is how that the practitioner who wrote that medication, how are they doing it? And then you are writing I'm sorry, I apologize for that. You're writing how they're actually taking the medication and the last dose, because sometimes it differs. People that are low income may have a hard time, doing this. Okay, continuing on, we talked about medications and how you note those. Now, family history. For each of these, this is important to note, If the person is alive or deceased, when, if they have a certain health condition, when they, when they got that, like the year, and if it led to their death. So, for example, my father had pulmonary fibrosis. He got it when he was like in his 60s, 62 maybe, and he passed away when he was like 69. Okay. For myself, I could tell you I have, let's pretend, high blood pressure. I've had it since 2009. Okay. The reason why we're asking that is to get a better idea of how long people have lived with diseases and possibility risk factors. Okay. Health promotion, disease prevention, and these are usually the only people. I mean, you sometimes have a lot more, but this is this is what you would the people who you would kind of ask about. Okay, talk about health promotion. You want to kind of ask, when was the last time that this person had a head-to-toe physical? This is not when they go to the urgent care or the emergency department. That is not a head-to-toe physical. That is a very focused visit usually. For those that are over the age of 65, Medicare does something called an annual wellness exam, and that's important also to just kind of keep track of. Required screenings, just know that the United States Preventative Services Task Force, I've done an active link here so you guys can go play around if you want, if you have time, to kind of just see what kind of screenings are recommended for certain people. Again, as nurses, this is something that we do need to know. Do you need to know it for this test? Only that the USPSTF is the body that recommends certain screenings. Okay. TB screenings, we're looking at homeless, maybe someone that's has been incarcerated, traveled to an area of the world where TB is kind of endemic, or it's like around, it's like a common thing. Anyone maybe with a chronic cough, some immigrants, need to have it. And then also some people, because of their jobs that they do, like us, healthcare workers, right? People who work in schools or in daycares, okay? Those are some of the things that yes, you do need to know about. That PPDs, TB skin screenings are under health promotion. And just like who may really kind of need that. Okay. Let me see what else. Review of systems. Just know this, that's in red, please. Okay, I'm going to have you read that, but it is a head-to-toe systematic review for things that the patient may not even know that relates to whatever's bringing them into the hospital, or it is a way to kind of just double check to make sure that there's nothing else going on with the patient that we need to let the provider know. Or in this case, in the case of the H&P, that the provider will actually be noting, okay? Maybe not addressed at this visit, but at some point, if there's something abnormal here, it will probably be, we'll have the patient eventually come back for some other visit. Okay. And again, just like the other document, the within normal limits document that I just saw that we just went over for nursing, just keep in mind that this is written from the patient's perspective. It's all subjective information, and it should be written like the patient is saying, no, I haven't had this, or I'm denying that I have any of these symptoms. Okay, that's all you need to know for that. Okay, this is for you to look at. Okay, physical examination. What do you need to know? Real important, it's objective assessment. Again, things that you're measuring, you're seeing yourself. You're doing an evaluation of it, of the system, and you're finding these things, right? You're seeing with any of your senses, okay? Height, weight, all of this. No, this is important. All of this is important right here, okay? What do I mean by percentile? On a pediatric chart up to the age of 21, I believe, they have charts for 0 to 24 months, okay, birth to 24 months, and they have charts that go from like 2 to 21, okay. On pediatric charts only, you would have percentiles, which means that on an EHR, it's calculated automatically. If not, you got to go look at a growth chart. That's the important part about that. And second of all, that it needs to be calculated if you're not working with an EHR, okay, for pediatric patients, okay. And then the rest of this part, I'm just going to tell you, this H&P is written very much like what you would see a practitioner's note H&P would be written. If you compare this document with the one we went over earlier, okay, slight differences, but there are some similarities, okay. And for you, what do you need to know of the physical exam is, in all honesty, I want you to know the stuff that you would be responsible for. Not this, but but in particularly the within normal limits. Okay. This is just for you to kind of see what a physical exam done by a physician, nurse practitioner, or PA may look like. Okay, when it's a really thorough head to toe exam. Other than that, I think we're done. Okay, and you can kind of, you know, look at all these things, and these are some additional testing things that might have been done either in the office or might have been done like in the emergency room, or you know, or whatever, consultations that they might have obtained that really kind of cover some of these things. But other than that, you know, I wish you guys luck. Just remember, I want you guys, you got to read, especially the things that I talk about in class. I really would like for you guys to read that. If anything, I want you all to be safe practitioners, safe registered nurses, okay, that can spot changes in a physical assessment, okay, in their physical exam, and to kind of start to put things together with the history. Okay, you got to know some questions to ask, basic questions of common things, right? And we do know that what's common, right? Pain's real common. I would definitely know that. Okay, good luck on your test, guys.